Hello, my name is Clay Young. I am a nurse practitioner student at Auburn University. I'm here to give you my 5-minute presentation on pediatric heart murmurs. A heart murmur is simply an extra sound heard when listening to the heart. The normal sounds a heart makes are from the valves closing. If there's turbulence or disturbance in the flow of blood through the heart or major blood vessels around the heart, a murmur may be heard. How are they diagnosed? You listen to the heart by placing the stethoscope on certain areas of the chest. It helps if kids are quiet during the exam because some of the murmurs are very soft. It's not unusual for a murmur to be noticed during a routine checkup, even if none was ever heard before. Heart murmurs are rated on a scale from 1 to 6 based on how loud they are. Grade 1 is very soft, whereas a grade 6 is very loud. There's two types. There's the innocent or functional murmur, which is simply the sound of blood moving through a normal, healthy heart in a normal way. Just as you might hear air moving through an air duct or water flow through a pipe, you can hear blood moving through the heart when there's no problem. Then there's murmurs which are due to structural problems such as a hole in the heart, a narrowed heart valve, or a leaky heart valve. And these murmurs will require further evaluation such as an EKG, chest x-ray, echocardiogram, or follow-up with a cardiologist. But who's at risk for these structural problems? They're usually genetic, family history of a defect. If blood relatives have had a heart defect, that increases the likelihood of a heart defect in a murmur. Illnesses during pregnancy. Some conditions during pregnancy, such as uncontrolled diabetes or a rubella infection, increases the risk of developing heart defects and a murmur. And taking certain medications or illegal drugs during pregnancy. The use of certain medications, alcohol or drugs, can harm a developing baby, leading to heart defects. So key questions to ask during the workup for babies: ask, are there any feeding difficulties? Cardiovascular signs and symptoms can be nonspecific and can help identify children who are likely to have structural heart disease. The mother may complain that the baby's dyspneic, have nausea, vomiting, fatigue, or a cough. For older children, ask if there's any activity intolerance. Parents should be asked about their ability to play because a high degree of suspicion is necessary to detect underlying cardiac disease. Parents may complain that the child has exertional dyspnea, syncope, or chest pain. And then just ask what types of symptoms are they having. The rationale for this is that it helps to determine if murmurs are benign or if there's signs of heart disease. Infants may have breathlessness, poor feedings, excessive sweating, blue episodes, or not gaining weight. And older children may experience exercise intolerance, palpitations, chest pain, or syncope. The child's appearance, activity level, color, respiratory effort should all be assessed during the physical exam. The neck should be examined for prominent vessels, abnormal pulsations, and bruits. And jugular venous distension is rare in children, so you should pay special note to that. The chest wall should be examined for abnormalities of the sternum. This can be associated with congenital defect and for abnormal cardiac impulses and thrills. And listening for areas for clicks. The upper right sternal border for aortic valve clicks, the upper left sternal border for pulmonary valve clicks, the lower left sternal border or the tricuspid area for ventral septal defects, and apex for aortic or mitral valve clicks. The lungs should be auscultated for abnormal breath sounds such as crackles, which may indicate pulmonary congestion or wheezing, or cardiac asthma. And the abdomen should be assessed, and especially focuses on the liver, because evaluation for liver enlargement or ascites may signal congestive heart failure. Common treatments, unless there's a severe defect that doesn't fix itself, aortic valve replacement or correction, but innocent heart murmurs are normal and they require no treatment. Even if the child's been diagnosed with a heart murmur that's due to a structural problem or disease, it doesn't necessarily mean they need heart surgery. Some murmurs are due to small holes between the two lower chambers of the heart, and these holes don't get bigger and often close by themselves. Other murmurs are due to narrowing or leaking of one of the valves, and however, this may be old. As far as teaching, once a murmur is confirmed to be innocent, reassurance to the family regarding its benign nature is important. Although the murmur may never disappear and may persist in adulthood, the parent and child need to be specifically reassured that an innocent murmur is simply an additional noise and not a disease or illness. If the child's been diagnosed with innocent murmur, no special precautions are needed for dental procedures, but those with structural heart disease are at risk for developing infection like endocarditis, so take antibiotics as prescribed by a doctor or dentist. And reassure them that there's not much to do to prevent a murmur and that murmurs are not a disease. They're often harmless. Most of them go away as the children grow. Thank you very much.